Most patients think improving a smile automatically means veneers. Cosmetic dentist Dr. Pamela Vranis weighs in on smile enhancement options from simple whitening all the way to full veneers. Stay with us until the end when she reveals one of cosmetic dentistry's best kept secrets for enhancing a smile. It's something most patients barely know exists. Have you ever seen someone where they have kind of have like a black triangle in between their teeth? How do you address that?
Totally. We also see that a lot. It's become something that we're seeing in our more aged population. They usually with gum recession, that black triangle, so that distance between where your teeth touch and your gums, that is that black triangle. And usually they're in the front teeth. The gums tend to be a little bit thinner and more sensitive to gum recession in those areas. And of course, they are the most visible areas. So it is in line with gum recession. So with these black triangles, we can do one of two things. Usually, a good option for some people would be to do something called gum grafting, which lowers your gum line and fills in that black triangle area with gum. And that's done usually by a periodontist, which is a gum specialist. And they're very well trained in doing gum surgeries like that. Another option would be if you don't want to go through a gum surgery, which is pretty painful. I have gone through it myself, is just composite bonding. So adding a little bit of composite material into those black triangle areas on both sides of the tooth can help change the visual and make it appear like that black triangle is not as big. So we can reduce that black triangle size down to being a little smaller and less noticeable.
That sounds like a beautiful result. My friend has had her black triangle for years and she's had gum surgery, and I feel so bad for her, but it sounds as though there's an easy solution.
Less invasive, definitely less invasive and quicker. Maybe more prone to needing to change it out in the upcoming years, but less invasive and reversible.
Someone else that I related to, she has just tiny, tiny baby teeth. I mean, is it possible to make teeth bigger?
Yes, absolutely. Absolutely. Peg laterals is what we call those baby teeth. They're usually right next to the two center front teeth, and they are a developmental effect where those lateral incisors just grow in a little smaller. And it happens, and it can happen on both of them. It can happen just on one of them. It's a developmental, and usually it's just how they grow in. So by adding with composite material, by adding material onto that existing tooth, which is smaller, we can build a regular size tooth that matches the neighboring teeth and make it appear like it's totally normal from the front.
Do you have to shave those down a bit?
Not at all. Not at all. Nope. You don't have to change the neighboring teeth at all. It's very conservative. We just work on that peg lateral, on that tooth itself. And with bonding techniques, we just add material to it.
Okay, how fantastic. Okay, I'm going to let her know. I'm so glad we're talking stuff. And now I'm thinking about my sister who throughout her whole life she has kind of this stain on her teeth, and it was from some kind of medication when she was younger. Don't leave before Dr. Vranis reveals one of cosmetic dentistry's best kept secrets, something most patients barely know exist. And now I'm thinking about my sister who throughout her whole life she has kind of this stain on her teeth, and it was from some kind of medication when she was younger. So that's
An
something
antibiotic?
I think so.
Keep recycling?
Yes. Yes.
Also very common. And as we've become more educated in seeing the effect of it years later, we have learned that tetracycline, the antibiotic, actually causes permanent intrinsic staining to the permanent teeth, to the adult teeth. So you want to be really careful if you're pregnant not to take the antibiotic tetracycline. You also want to be really careful up until about the age of 8 for your child to not take the antibiotic tetracycline. It's something that we can correct through, again, a wide array of methods that we use, one being veneers, lab made veneers, and one being composite bonding that we use. And it just depends on the depth of the stain, how mild it is, how severe it is. A more mild case where there's just faint discoloration, we could do composite bonding. If that stain is just a little bit more, a little deeper, a little bit more tenacious, then we would go and move, and we would want to move to a lab made prosthesis, a lab made veneer to really make sure that that discoloration is not showing through the work.
Okay. My sister did get something done and she always has problems with it chipping off. Is that a risk of the treatment?
Yes, it is a risk of the composite bonding. Unfortunately, while it's very conservative in nature, non-invasive, the risk or the downside effect of it is that it can chip a little easier than a veneer can. However, a veneer, a lab-made veneer, can also chip. Maybe a little less prone to chipping, but it can chip. You do want to be careful with any kind of composite bonding or lab-made veneer. Any dentist will tell you that if that material is added on to the edge of the tooth where you bite into things, you want to be very, very careful to not bite into anything hard. Apples, corn on the cob, those are just things that you have to be aware of for the rest of time.
Okay. So maybe she had them kind of put under on the bottom of her teeth or top of her teeth.
Yep. We call those the incisal edges, but yes, they're on the bottom of the teeth closest to your other teeth.
Okay. Yes. And if you're chopping on popcorn seeds, that is probably gonna chip.
Oh yeah, definitely. A popcorn seed can chip a back tooth, a molar. So it can definitely chip off anything made in the front, which is thinner and more delicate. Be careful with them.
I know exactly. Oh my goodness. What about, oh gosh, they're the most beautiful smiles on earth, but they tend to be more gummy. Beauty seekers, we appreciate you joining us here for this interview with Dr. Vranis. If you like the education we're sharing, please subscribe to Beauty Seek. Gosh, they're the most beautiful smiles on earth, but they tend to be more gummy. Is that something you work with?
Totally. Gummy smiles are really challenging to work with. They show everything. And that's what even a patient with a gummy smile will say is that my teeth always have to be clean. My gums always have to be not inflamed because they show. They show. So if we do any work on the areas closest to the gums on someone who has a gummy smile, it is so important that everything is perfect because it's going to show when they talk, when they smile in photos. They'll see it first thing front and center when they're looking at themselves in a mirror. So we really want to pay close attention to the polishing techniques that we use in cases like that. So if we were to, for instance, put a little bit of composite bonding near the gum line, that has to be done to perfection. It has to be so smooth. It has to be thinned out as it approaches the gum line to not allow for any inflammation towards a gum line. Same thing with a veneer. a lab made veneer. That has to be done so thinly and flushed against the gum line because everything's going to show. And you really want to make sure that when you're preparing the teeth to add the composite bonding or to make a lab made veneer for that trimming and contouring of the tooth is done in a way that it's below, or in this case above, the gum line, so that it seems totally flushed and uniform as you go up against the gum line, because it's going to show. It's so obvious and evident with a gummy smile.
Okay. And then does that kind of get rid of the gummy look, or is that
You can, so that is a whole other thing, which is so fun, where we actually can raise the gum line up and create a longer tooth look. That's really fun. And that's also done by a periodontist, a gum specialist, where they can do something called a gingivectomy. So they cut the gums and recontour the gum line. So the scalloping line changes from maybe being a little lower to a little higher. And therefore, maybe, especially on the severity of the gummy smile, if it's not as severe and the lip line, the upper lip, is only about a millimeter from the scalloping of the gums around the teeth, then that's something that's probably very correctable with a little bit of gum contouring with that gingivectomy process. So that's really exciting. Or if there's a more severe case, where there's just a gummier smile, it can always be reduced, which also looks really good. And patients notice that change. A millimeter goes a long way in the mouth. Every millimeter counts.
okay? That's great to know that there's this, because they're the most beautiful smiles that I've ever seen. It's just, we've got this kind of gummy feel, and humans for some reason don't like too much gums.
And
So
usually patients with gummy smiles have the brightest smiles because you see so much. You see so many teeth, you see the gums. They tend to be really happy smiles. So it really does make a difference when you can help them achieve a goal of theirs, which is just to show a bit more teeth and less gum.
if teeth whitening, maybe some aligners, some reshaping, gum grafting, all of that is eh, maybe not enough to get a beautiful smile. There's enough issues. What would we move into for a suggestion solution? Or keep watching. Dr. Branna shares what she has seen change smiles the most. So if teeth whitening, aligners, maybe some tooth reshaping, some of those solutions, addressing the gums, if that doesn't necessarily allow for the most beautiful smile that we want, there's like bigger issues potentially. What would you suggest to a patient?
A great suggestion would be, and a great option, are lab made veneers. They are the traditional veneers that we all know and see on TV. They are facings, so they just go around the front of the teeth. And they're great options if you really want to change your smile and are really convinced of it. I say that because most times for veneers, we have to trim down our teeth a little bit in order for those veneers to then stick on top and not look and feel bulky. So those are great. Veneers are great options, but they are what I like to say irreversible options. You can't really go back. Once you trim down that tooth on that front surface, then you will forever have to have veneers. So it's something that you really want to consider and talk through with the patient extensively, and have a full treatment plan, and even show them an after photo of what they're going to look like with a veneer or veneers, because usually veneers are done not just one tooth at a time, but either two, four, or six. So veneers are great options, but what I like to tell patients is that it can be an irreversible option, given that we have to shave down the teeth a little bit on that front side of the tooth in order for the veneer to pop on and not look bulky. It's an option that is great and it changes the shape, the shade, the uniformity of an entire smile, depending on how many teeth the patient and the dentist decide to do. It can be one tooth, two teeth, four teeth, six teeth. That's usually the amounts. Usually we do it in pairs, working from the center and outward towards the canine. So it's an option that certainly changes the look of a smile and has a lot of potential, but it is irreversible. So the patient just needs to know that and be really convinced that that is what they really want to do.
So they only go in the front of the teeth?
Yes, they only go on the front of the teeth as opposed to crowns, which we can definitely talk about crowns because there is a difference there. Veneers only go on the front of the teeth and they wrap around a little bit over that incisal edge. And so there is a small amount of veneer on the backside of the teeth, but the purpose of them is to be a full facing of the teeth. Yeah.
So will you, okay, if they go around the tooth, will you feel it with your tongue on the inside?
You do. And that's something that patients do notice. They're like, oh, I feel a little ledge on the insides of my teeth now. And they get used to it. It's flushed against there. It's just different at first. But it's totally flushed and actually the more wraparound it has, the more retentive it's going to be. Meaning, the less likely they're going to chip, flick off, fall off. So they're actually better for the longevity of them to have a little bit of a wraparound rather than just being just a front facing.
Okay. And you referred to lab made as opposed to how else would they be made?
Chair side.
Oh,
There, yep.
okay. We'll have to get there. So let's talk about the colors. If you're only doing two, how do you make that work with all the teeth that have are probably various colors? Keep watching. Soon, Dr. Vranis is going to share what she has seen change smiles that most people think can't be fixed without surgery.
Shade is so important when you're doing a veneer or a crown. Anything in the front, shade is highly important. Teeth naturally have about three shades to them. So you'll have a different shade near your gum line, you'll have a different shade along the body of the tooth, and then you'll have a different shade along that incisal edge. So you're when you're making anything, and especially if you're sending it out to the lab, a dentist is usually also taking photos and making sure that the lab can really get of the visual of the patient, their their entire face, zoomed in photos of their teeth. You really want the lab to have as much information as possible to make the best veneer, especially if you're doing six veneers and you're really changing your smile line. The lab needs a lot of information. Now, if you're just doing one veneer, us dentists always say this, one veneer sometimes is harder to match a shade to than six because all six, you're going to make them the same or you're going to feed off of the other. But when you're just trying to match one tooth to the neighboring teeth, and like you said, a lot of times those neighboring teeth have all of these different shades. The first and foremost thing that you should do is, or that a dentist should do and explain to the patient, is actually whiten your teeth. Whiten the teeth. Yes. The more accurate of a picture that we have before starting to shade match, it is really important. First of all, patients might have some staining on their teeth. They should get a cleaning and they should get their teeth whitened to make sure that then we are matching and we're making that veneer or those veneers as accurately based on their most whitened teeth, because a veneer won't whiten. So if then someone goes to whiten their teeth afterwards, that's not going to the veneer is not going to whiten, and so it's going to then look a little awkward. So you really want to match up that veneer shade with the whitest teeth that the patient can get.
That makes sense. And especially what you said about one tooth. I mean, I think I can just remember smiles throughout my life where one tooth that was different from all the rest just really stood out.
Totally.
But if you're so the challenge with veneers then is you always need to keep your teeth as white as you match the veneers to.
Totally. Which is also a healthy habit to get into, not necessarily the whitening, but it means you're having excellent hygiene at home, which is really important for maintaining the veneers. It means that you're going to the dentist for your cleaning 3 times a year or twice a year at least. It does promote good hygiene and good veneer etiquette.
So before we move on, because I'm very interested in crowns as an option to veneers, what questions should a patient be asking of their dentist as they're trying to determine if veneers are right for them? Beauty Seekers, we're so happy you're here for this interview with Dr. Vranis about veneers and enhancing your smile. If you would like more education about aesthetic procedures, please subscribe and we'll be sure to do more interviews like the one we're doing today with Dr. Pamela Vranis. What questions should a patient be asking of their dentist as they're trying to determine if veneers are right for them?
Great question. First off, if they are good candidates, meaning are their teeth strong enough? That's first and foremost. Can they stay strong during the process? So there is going to be a little bit of drilling. So you really want to make sure that their teeth are healthy enough and in good status, in good condition to go through that process. You also really want to be asking the questions of why a veneer versus a crown? What's the difference? Will my bite fare well with veneers? A lot of times we do hear about veneers popping off. And that has a lot to do with not just the technique of how that veneer was made or what material was used, but also how that bite comes together. And is that veneer constantly getting pushed out by the lower teeth? So, and another good question would be if a patient would have to wear a night guard. So asking, hey, how do I maintain my veneers so that they last for as long as possible? How do I clean them? How do I need to wear a night guard to make sure that I'm not grinding at night and causing them to loosen and weaken and then more prone to fracturing or popping off?
Okay, that's great. And how long can veneers last?
They depending on these factors of that bite, the maintenance of them, good hygiene, they can last decades. I work on patients where they have had veneers for 40 years and they've never changed them out. So it really depends on factors like how they're maintaining them, like I said, how that bite what is so that they're not constantly coming into contact with them, and of course how they were made as well does make a difference. They do need to have some strength to them and therefore some thickness to them, which in turn means that to have more thickness on the veneer, the tooth would need to get shaved down more. So to get more thickness of that material, the thicker the material can be, so like 0.5 millimeter versus 2 millimeters, is quite significant in lab made veneers. And a 2 millimeter veneer is probably going to last longer than a 0.5 millimeter veneer. While a 0.5 millimeter veneer looks really good, and it looks probably more natural, that's where that technique and that lab quality makes a big difference. Because if you're using good material, you can have a thicker veneer and still look very natural.
Okay. And I had such a good friend. She had her two teeth redone and they always looked very thick.
Yes, that's common.
Okay. Okay.
It's tough. It's really tough. And it's sometimes not just the patient's anatomy, it's not just the dentist's hands. Sometimes it's also what material the lab is using. And
Really?
just being and really having good awareness and a good relationship between the dentist and their lab is also really important.
Okay. And do you subscribe to a certain type of veneer? I've heard of 3D printed veneers.
3D printed veneers are becoming a thing.
You won't want to miss what's coming up. Dr. Vranis is soon going to share the smile enhancement option that some consider to be one of dentistry's best kept secrets. Wow. Oh my goodness. I know we just scratched the surface today on different techniques for enhancing a smile, and you've taken us through a lot. And thank you so much for sharing this best kept secret. These composite veneers chairside is just an amazing, approach that I wasn't completely aware of. And I'm glad I am, because now I'm going to go to my dentist and walk in and say, Dr. Vranis gave me some information.
Absolutely. My pleasure.
Yes. Thank you so much, Dr. Vranis. You are a gift to the beauty seek community. Thank you for your time.
Thank you.